I want to start today's episode with a story, one I'm hearing more and more across the Bay Area. A daughter in San Jose recently told me she was drowning in caregiving and her mom had dementia and she was working full time and every day felt like juggling a dozen emergencies. She didn't know what support existed, what programs were available, or who to even call. And then she received a letter from Medicare about something called the GUIDE program. She had no idea what it meant. And you know what? Most families won't. The GUIDE program is brand new. It's complex. It's about to affect millions of families caring for loved ones with dementia. And very soon, families all across the Bay Area will start receiving official Medicare letters without any real explanation of what to do next. So today we're going to break this wide open. I'm Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. And as someone who's part of the sandwich generation myself, I know how stressful it is to balance parenting, work, and caring for aging parents. I created this podcast, Simplify Senior Transitions, to make senior care conversations easier. And my promise to you, every episode brings you real stories, practical tools, and expert insights to help your family move forward with confidence instead of stress. Today, we're talking about a government program everyone will soon hear about, but few people truly understand. And I've invited someone uniquely positioned to help us make sense of it. My guest is Clifford Shaw, owner of ComForCare Home Care Central San Jose, and someone who brings not just experience in home care, but decades of medical sales and healthcare operations knowledge. Cliff understands the healthcare ecosystem at a deeper level than most home care owners. And he's here to simplify the GUIDE program for all of us. This is the episode families need before these Medicare letters arrive. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by senior transition specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
Hey, we're back, everybody. Cliff, welcome to the show today. How are you?
Good. How you doing?
I'm good. Cliff, we have been friends for a while now, and I know you've been in medical device sales and radiation protection, 20 years, right? Which many of our audience members may not know, but why did you decide to purchase a ComForCare franchise, and how does your healthcare background influence the way you run your agency?
Great question. Why I decided the last few jobs I had in the medical arena, I didn't really feel like I was helping individuals. And so I went and tried to find something that I would truly be helping individuals. And as a home care organization, we provide great support for our seniors and helping them out, as well as our caregivers. So we're able to assist people on both sides of the equation, both the families and our caregivers. And that's why I decided to get into the home care industry.
Okay. Now, why did you decide to purchase a ComForCare franchise specifically?
I decided to purchase ComForCare because it gave me a lot of different specialty programs, including specialty programs on dementia, like the one we're talking about today on GUIDE.
Okay. Related question is, how does your healthcare background influence the way you run your agency?
My background experience with the healthcare industry enables me to truly understand the multifaceted aspects of the healthcare industry, especially regarding Medicare and other complex programs that the federal government has, as well as how it kind of can degrade the healthcare industry and sanction them if they don't have enlarged readmission rates.
Let's move on to the core topic of this episode, which is GUIDE. What is GUIDE? And part two of that is, how does your background shape your understanding of healthcare policy and programs like GUIDE?
Sure. GUIDE actually stands for Guiding an Improved Dementia Experience. The idea behind GUIDE is that with dementia, there's no core organization to help families understand what's involved and how to best relate their care, which with my past experience, I always see how, like with cancer, you talk to an oncologist, they can give you all sorts of details about cancer and how to get help for cancer and all the resources available for cancer. With heart disease, you go talk to a cardiologist, they give you all sorts of details about heart disease, all of the different treatment options with regards to heart disease. And that really doesn't exist for dementia. And that's what the federal government is trying to cover with this program, is giving people resources besides the Alzheimer's Association and some of those, which are awesome resources, but more of a medical perspective on the dementia care and how to get resources for it.
Now, one big benefit families hear about is care coordination.
Mhm.
What does that actually look like day to day?
So care coordination is at the core of the GUIDE program. You think about it, care coordination means that somebody's helping you manage care schedules, manage medications, understand what medications are available, understanding all of the different intricacies involved in dementia care. There's a lot of different aspects of dementia care. There's a lot of resources available in dementia care. That care coordinator should help you find all of the resources. And those care coordinators are typically hired by the groups that are participants versus organizations like them.
How does GUIDE support overwhelmed family caregivers emotionally, not just logistically?
One of the benefits of GUIDE is actually 4 hours of respite care per week.
Okay.
And that enables caregivers to get some breaks and really think about what all they need to do during those 4 hours. It could be as simple as taking a nap so that they're less tired, but it also could be figuring out and talking to people in like the Alzheimer's Association or organizations like myself, even organizations like yours, where we have resources available to give those loved ones additional help and potentially feel less overwhelmed, either through just the break or other aspects.
Okay. Now, it's great hearing that GUIDE does provide that respite care. I think you mentioned 4 hours a week. Does it offer any paid caregiving support?
Yeah, the care coordinators actually have tons of resources. Let's say somebody gets combative. That care coordinator might talk to you through how to de-escalate the process or if medication's the right answer. That's where that care coordinator really can play a vital role in helping that overwhelmed caregiver, especially because they're going to have all the note physician visits, as well as all the notes that an organization like mine, which provides the respite care. So they're going to have a lot more notes and details about what's truly going on. And that's going to help them give you better feedback on how to make things simpler for your loved one with dementia.
I want to talk about the eligibility requirements to use the GUIDE program. Which families are eligible, and is this only for Alzheimer's or all types of dementia?
That means they need to have part A, B, and the drug part, which is part D. They can't have, unfortunately, the advantage part, or which is part C. So you can have a supplemental insurance policy, but you can't have an advantage insurance policy
Okay.
to receive benefits of the GUIDE model.
Now, what is a GUIDE participant, and how does it differ from a home care agency?
Great question. So, as I said, we aren't a GUIDE participant. GUIDE participants, a lot of them are actually online or virtual or remote
Mhm.
doctor groups that are doing their visits via telehealth. Telehealth is a huge part of the GUIDE program. But there are also some local participants in the Bay Area, UCSF, STAN, and Hudo Care. Either way, what they're going to do is assign to you, once you qualify, a care coordinator. Those care coordinators are the people that would find organizations such as myself to provide the respite care.
Okay. Now, you're the first person that told me about GUIDE. I'm wondering, why are so few home care agencies prepared or even willing to participate in GUIDE?
I think it's two factors. One is lack of knowledge.
Okay.
Two is they're not necessarily as high a paid reimbursement rate as some other
Okay.
channels. But let's start with a lack of knowledge. I mean, I don't think it's something that most home care agencies, especially those that are not part of franchise systems, know about. And I'm not sure it's something a lot of the franchise systems have even really been willing to talk about with their franchises. I'm lucky. Our franchise system has embraced it wholeheartedly.
Yep.
And that enables us to have at least 5 different GUIDE participants as part of our system, as part of our organization.
What questions should families ask any participant before choosing them for GUIDE?
This is, it's like choosing a physician. You're
Mhm.
going to want to ask the same types of questions you ask of the physician. You're allowed to shop the participants to find the one that works best for you and your loved ones. Once you sign with the one and finish the process, you can even change that for participants if that you find that that person isn't really meeting your needs. As I said, it's kind of like finding a doctor, and the participants kind of are the doctors in this particular case.
Okay.
They're the ones that are providing all of the resources for your loved ones,
Okay.
from home care agencies to care consultations to trying to understand exactly what's going on, to potentially bringing PTOT, other types into your loved one's life to make their life better and help them live their best life possible. But those participants kind of are controlling a lot of the care. They're not eliminating your private care physician, but they're there to supplement that private physician.
Okay. Regarding ComForCare's participation in Guide, how is ComForCare preparing differently from others?
I think the idea that we've really contracted with multiple providers is a huge thing. I talked to a couple other agencies and they've got 1 or 2 people they've talked to, whereas we have 4 to 5 to 6 to 7 different providers that are working with our system, franchise system, to become and for us to become trusted providers for.
Does the franchise model help?
I think in this particular case, it absolutely helps because the franchise system then can also negotiate the contracts, make sure the contracts are fair for both sides.
I want to segue into enrollment and what families should do right now. First question is, how does a family enroll a Guide?
If the family has questions, they can always call me and I can help them with the enrollment process.
Okay.
They can also call any of the participants. Actually, if you go to the Medicare website and go on the Guide tab, they actually list all of the different participants. The enrollment process is actually pretty simple. It's filling out some type of form, then verifying dementia diagnosis, verifying your eligibility from just having the specific parts of Medicare that you need, and also verifying that you have a family caregiver involved. Because that is one of the other requirements for the GUIDE program is the family caregiver needs to be involved. They can be helping with meal plans, they can be helping with physician appointment, and those types of things. It can be 1 or 2 hours a week, but it definitely involvement of a family.
Along the same lines, any other things that families can do today to prepare for Guide even before the Medicare letter arrives?
They could enroll today. GUIDE actually officially started in July of 2024, and it's been funded for years. So we're year 2. And the reason that Medicare is sending out those letters is they found that the enrollments are not as big as they expected them to be.
Because the awareness is probably not there. And this is why we're doing this podcast. Now, if a family member is already overwhelmed, what is the easiest first step?
Calling somebody like myself and walk you through that enrollment process, if that's the direction you want to go. Obviously, getting help. There's lots of resources out there. Reach out to either Alzheimer's Association or organizations like myself, even organizations like yours, where we have resources available to give those loved ones additional help and potentially feel less overwhelmed, either through just the break or other aspects.
Now, how can senior care professionals like myself, realtors, placement agents, fiduciaries, care managers integrate Guide awareness into our work with families?
I think a big part of it is you guys being aware of the existence of this program. If you're talking to somebody that's not ready to move or doesn't want to move because their loved one's going to be so confused if they leave their home environment because of the dementia, bringing it up. This is a resource that is available. Knowing where on the Medicare website to potentially find information, asking organizations like myself for resources on it, because there's a lot of resources out there for GUIDE, but it's very much a hidden resource, and they're very hidden, fortunately. And that's part of why we're doing this podcast, is to try to make sure people understand resources do exist.
What's one thing you hope every listener remembers about Guide?
That you're not alone, and that there is probably going to be changes as we move forward for the care model with dementia on what Guide is doing and what Medicare is going to probably push on to Advantage plans moving forward based on this experience.
What do you wish families understood about the healthcare ecosystem that could help them navigate programs like Guide?
You have to be your own advocate, and you have to be the advocate for your family members. You got to remember that nobody is going to want to take as good care of you and your loved ones as you are. And if you aren't a strong advocate for your own needs and wants, nobody else is going to.
Yeah, I agree with you on that. 100%. I want to know your thoughts about the future of Guide and even long-term care. What do you think Guide will look like 5 years from now?
We're at right about that 7-year mark when you're talking 5 years from now.
Yeah.
If it's been successful, it should hopefully be integrated into regular Medicare at that point. If it hasn't been successful, probably be a step backwards for the dementia world as a whole. So we need it to be successful from a care for our seniors and the elderly that are getting dementia, because otherwise it's a great situation. One of the big reasons they created it, besides realizing that there's that gap in care, is realizing that folks with dementia can cost Medicare and other federal programs so much money. If it's not successful, we're not saving the money that they're hoping for.
Well, then how should families think about long-term care now that Guide exists?
So there's obviously 2 or 3 paths, as you're well aware. There's the path of going to skilled nursing facilities, which is probably the least advantageous. There's the memory care option that can be very, very great for a lot of folks. And then there's the stay-at-home path. I think this makes the stay-at-home path a little bit more viable and a little bit better option for many people and their loved ones.
What message do you want every adult child of a dementia parent to take away?
That Guide is here to help you, even if you're in, let's say, assisted living or in independent living, even in a facility, you can be part of the Guide program. So it's a resource. Learn about the resources available. Find people to help you understand all of those resources, such as yourself.
Yeah. Shifting just a little bit, I want to talk about dementia and your dementia training. I know your dementia training is unique. From what you told me, it's backed by Duke research and built on the DICE model. Can you explain what DICE stands for and how it helps your caregivers?
Sure. Let me go back a step. The dementia model that was created for ComForCare was created by a woman by the name of Heather McKay. She's out of North Carolina. She's a occupational therapist. She created over 10 hours of training videos for our caregivers that we as an organization spread out over the course of 2 years. One of the key elements of that training is DICE, which is describe, investigate, create, and evaluate. It's how we de-escalate people with dementia so that they're less likely to be violent. I truly believe that if somebody with dementia has an outburst, it's because of something in their situation has caused them to get upset. And it's better to do a non-medical approach than to try to have to medicate every single one of those. And that's really the purpose behind DICE, is to truly understand the root cause of the anger and aggressions so that they can be eliminated by that instead of some other mode. Let me use a simple story.
Yeah.
We had a client that really got upset every time their breakfast was prepared in a way they didn't like. If their eggs were runny, they would get really upset and throw the food on the floor. Very obvious what the root cause of this problem is. Their way that the eggs were prepared. Not all situations with dementia are that obvious. That's the purpose of DICE, is to get that to a deeper level. Duke actually studied the methodologies behind this and the implementation of those methodologies and created a white paper that they presented to the Alzheimer's Association and allowed us to be Alzheimer's recognized as an organization.
Now, how does this dementia approach improve outcomes for seniors and reduce stress on families?
So if your loved one is less agitated, obviously there's going to be less stress on the family.
Mm-hmm.
And that's really the key element of this program, is trying to reduce the stress on the family and reduce the stress on the person suffering dementia. If they aren't agitated, their stress level's lower and they're going to get better care and not necessarily have to take as many medications with all the side effects for either anger or aggression or all the different sedatives that they give folks with dementia to try to make it so that they're not upset.
Okay, I get it. And how does specialized caregiver training set families up for success once they enter GUIDE?
Our training is a bit unique and gives us a leg up as far as understanding the dementia world, and directly affects how our caregivers work with individuals that are on the GUIDE program, because they're using that same training to work with their clients that have dementia and are part of the GUIDE program. So it allows somebody to just de-escalate the situation instead of needing medication to solve the potential issues. It also enables us to understand sundowning a little bit better and how to best, keep somebody engaged. Because engagement means that they'll be awake during the day and sleeping during the night instead of vice versa.
I'm going to bring in the topic of fall prevention. How does fall prevention tie into dementia care?
I'll go back and tell you another little story. I once was working with a client that needed a walker. Unfortunately, with dementia, they forgot how to use a walker. And so they kept wandering around without the walker. That increases their fall risk. We, as an organization, teach a course called Matter of Balance. It's an 8-week, 2-hour per week course that changes people's thought process on falls from I'm going to fall to I can control if I fall. We can use some of those same tools when working with somebody with dementia to make sure that they are doing aspects to keep them safe. Back to that person that was using a walker. So what our caregivers do in that case is make sure the walker comes with them so that if they start falling, they grab the walker and hold on to the walker. With somebody with dementia, you want to stay in front of them, because one of the aspects with dementia is actually they slowly lose vision. Think about it as putting your hands out and slowly closing your hands. And that's what the field of vision does with dementia. So you want to communicate with them in a way that those aspects will work.
Okay, I like that. Now, for the Matter of Balance fall prevention program, how does it fit into a larger care plan?
We talk a lot about dementia. Really, the strength of Matter of Balance is fall risk mitigation, either osteoporosis or heart disease or any of these other diseases that affect your balance and like strength a lot more. Dementia does affect that to a point. I use Parkinson's for an example, or any of the other movement or disorders. As your legs weaken, it really talks about how to strengthen those leg muscles, but also to think about all of the ways you can overcome, to reduce the risk of walking on slippery surfaces, choosing good options instead of the straight line path, and some of those types of aspects.
Well, how are your caregivers implementing fall reduction strategies that align with Matter of Balance?
That's one of the key aspects when we're talking fall prevention in our organization is talking about one of the big components in almost every one of our care plans is trying to make sure they continue exercising in some way, shape, or form. One of the biggest causes of any fall is weakness in your lower extremities. So if you're doing things to strengthen your lower extremities, even for a senior, you're going to help prevent falls. And we make sure that we do anything we can to try to strengthen the extremities on our people that we're caring for, because we do want to see them succeed and live their best life possible. It's actually our company motto.
Noted. Now, I also know you're preparing for advanced Parkinson's training. How will that support families with more complex conditions?
One of the biggest challenges people with Parkinson's actually face, managing the drug regimen.
Yeah.
And that's going to be a big part of the training I'm going to be doing. is understanding how those drug regimens really work and how that combined with how to feed, like obviously we talked a lot about matter of balance.
Yeah.
The strengthening of the muscles and keeping them as strong as possible. Is, as we're all aware, Parkinson's and other movement disorders really are degrading their muscles and weakening their ability to help somebody stand.
Now, just to wrap up, do you have any final words for the audience? And also, how can someone get a hold of you if they had any questions?
Let me start with how to get a hold of me. The simplest way is to give our office a call, which is 669-333-3141. Feel free to call us at any time, 24/7. As far as things that I'd hope that the audience understands is that not all home care agencies have the same criteria as far as training goes. And that as a ComForCare franchise, I really feel like we have some of the best training.
And I know your territory is specific. I should have asked this earlier on, but can you also tell everyone where you offer services for home care?
Yeah. So my agency is very territory specific as part of a franchise. We have half the city of Santa Clara County, North San Jose, Milpitas, East San Jose, think everything east of Highway 87 in San Jose, South San Jose, including Almaden Valley, Blossom Valley, Evergreen Valley, and then we go down to Gilroy, Morgan Hill, San Juan Bautista, and Hollister in San Benito counties.
Excellent. Cliff, thank you so much for being here today and for helping break down something that so many families are about to hear about, but won't fully understand without conversations like this. The GUIDE program has the potential to be a real lifeline for families caring for a loved one with dementia, but only if they know what questions to ask, who to trust, and how to navigate the system without burning out in the process. And I appreciate you taking the time to explain in a way that's practical, honest, and family-centered. And to everyone listening or watching, if there's one thing I hope you take away from this episode, it's this. You don't have to figure senior care, dementia care, or Medicare programs alone. Help exists. You could reach out to Cliff, for example, but it doesn't always show up with clear instructions. And that's why I created this podcast. My promise to you is simple. Every episode of the Simplify Senior Transitions podcast, again, brings you real stories, practical tools, and expert insights so you and your family can move forward with confidence instead of stress. If you're caring for a parent with dementia, or you think you may be soon, and you're trying to understand what the GUIDE program means for your family, now is the time to get informed. And if senior living or a housing transition is also part of that conversation, I'm here to help with that too. You can schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com. Or you could reach me anytime, send me a DM on Instagram at SoldByDale. And before you go, if this episode was helpful, please take a moment and leave a 5-star review on Apple Podcasts or Spotify. It really helps more families find the show and get more of the support that they need. And don't forget to share this episode with someone who's caring for a loved one with dementia. It can make a real difference. Thanks for tuning in. Cliff, thank you one last time for being a guest on my show today.
Thank you.
You're very welcome. And for the rest of you, I'll see you on the next episode of the Simplify Senior Transitions podcast.